Hello and welcome to Health Matters on Channels Television. We're so glad you could join us. I am Mary Alale Yusuf. Hepatitis is an inflammation of the liver that is caused by a variety of infectious viruses and non-infectious agents, leading to a range of health problems, some of which can be fatal. There are 5 main strains of the hepatitis virus, types A through E. Types B and C lead to chronic disease in hundreds of millions of people and together are the most common cause of liver cirrhosis, liver cancer, and viral hepatitis-related deaths. Globally, approximately 354 million people worldwide live with hepatitis B or C, mostly untested and untreated. According to the World Health Organization, an estimated 4.5 million people can be spared premature death in low and middle income countries by 2030 through vaccination, diagnostic tests, medicines, and education campaigns. WHO's Global Hepatitis Strategy, which counts from 2016, aims to reduce new hepatitis infections by 90% and deaths by 65% by 2030. My guest on the show is a consultant public health physician, Dr. Jamiu Ganiyu. He joins us online from Bagada. You're welcome to the show.
You're welcome. Thank you, Mary.
Hepatitis causes liver infections. What exactly does it do to the liver? How does it change the liver?
Thank you very much for the question. Actually, what the virus does is that it kind of cause damage to the liver cells, the hepatocytes. Usually is a gradual thing. It normally started gradually from IQ stage, and eventually it keep on, spreading in terms of the level of damage, and eventually, when there is a damage to the cells, what happens that there is an inflammation, and in so doing, the liver will try to kind of regenerate. So as it becomes chronic, the regeneration end up becoming a kind of fibrosis. Instead of normal cell regenerating, the liver will try to regenerate, but forming fibrosis, which is a form of a scar that eventually cause what we call liver cirrhosis with severe damage to the liver.
Viral hepatitis is the one of most concern, especially hepatitis B and C. But yes, can you take a moment to educate us about non-infectious hepatitis?
Well, okay. What concerns the national program is the infectious, but the non-infectious also arises from actual different ways. For instance, it could be through drug reactions, which can be either medically, maybe by taking drugs. For instance, taking anti-TB drugs. And even or abusing drugs like overdose of paracetamol and so on can cause liver damage. Yes, also toxins. There are toxins like people that they work on aflatoxins. It is found in the granules, especially all those rotting granules. So they can also lead to damage to the liver. So also we have some metallic compound, maybe when it is unknowingly digested or somebody is exposed, like copper, they can also cause liver disease. Then there is also called people that ingest alcohol. There is also alcoholic liver disease, which can lead to inflammation causing what we call fatty liver. And eventually, if nothing is done, it can also progress to liver cirrhosis. So these are some of the examples of other ways apart from non-infectious, apart from the infectious ways that can lead to liver disease. Yes.
Can you educate us about the symptoms of hepatitis?
Okay. I want to tell you that generally, both acute and chronic may not be symptomatic. That one makes it very there is a kind of silent disease. At times people may think they're okay, whereas the virus is they're causing serious damage to the liver. But in an acute state, somebody can just have nausea. that is feeling like they want to vomit. So, but the common thing that they may have anorexia, inability to eat. And at times they can also have occasionally fever, mild-grade fever. And some people have germinus of the eyes, which is called jaundice. And they may be complaining of right upper abdomen pain. So it depends. That is, I'm talking of acute stage. But usually when it becomes chronic and started causing complications, it can give symptoms that suggest a symptom of dysfunctional liver. That is, they will become wasted. They may develop a complication we call portal hypertension. You see the abdomen becoming bigger. They may start having water retention in the system, which is manifested in form of swollen abdomen. We call it ascites. It could even, be shown on the ankle, edema. You get it. And in worst cases, you can see them bleeding because the liver is found to be responsible for producing vitamin K dependent protein factor. That is proteins that are responsible for controlling bleeding in the system. So when the liver is damaged, those protein can be lost, and somebody may be having bleeding problem, bleeding from the mouth, from the nose, and so on. Those are in worst cases. And also, what may complicate the bleeding may be also low platelet level as a result of what we call swollen spleen. We call it splenomegaly. So these are some of the, and again, you find that when the liver is damaged, there's what we call bilirubin may not be properly conjugated. At the end of the day, they may also, you may see some tincture of jaundice in the eye. So those are some of the symptoms, especially the chronic case. They look so sick, so wasted, and so these are some of the symptoms that the chronic phase may present.
Unfortunately, that's at the end of the infection. But happily, yes, there's a vaccine. Now, yes, how many hepatitis vaccines does a child need to receive to have full immunity? And are they all available under the expanded program on immunization?
Yes, they're available, especially for the under 5.
All there are, doses?
Yes, 4 doses. Usually they take it at birth. Then they need to repeat. The first one at birth is called the monovalent type. It's only a single one. Then afterwards, they will take it at 6 weeks, which is part of the pentavalent vaccine. They will also repeat it at 10 weeks, and they will take it at 14 weeks. So it's usually about 4 doses. That is for infants. And it is expected that when they take that, they will achieve a long-time immunity against hepatitis B. I'm not talking about C, B, because there is no vaccine for hepatitis C, but there is cure for hepatitis C.
Okay. So why, after so many years of having the EPI, are we still struggling with hepatitis infections?
Yes, what happened was that when the hepatitis immunization was introduced, there were a cohort of individuals who were not privileged. They've outgrown that age. That is the infancy age. So they've grown up into the adult or beyond that age. So those are the people that I think may have more exposed in terms of, especially for those who are not immunized, who are missed at that period when routine immunization for free routine immunization for hepatitis was introduced. So those are the category of people that may likely, or even among the children that are supposed to even take it free, some of them miss. If you look at the coverage of our routine immunization again, you find that is still something that needs to be improved. To achieve some level of immunity, the coverage must be, we talk about at least 80% and above. But that has been the challenge. It's not even hepatitis. Look at what's happening currently, diphtheria and so on. So the coverage of our routine immunization has not been encouraging. And what is even most the main issue now is the fact that the 0 dose, which is very, very important. you find that it's around 30-35%. So these are some of the issues. So our immunization coverage in terms of hepatitis B, I'm talking on the 5, has not been really encouraging. And also in for those adults who have not achieved immunity, also some of them are so ignorant that they don't know that they need to go for immunization. And because this is coming out of pocket, some people tend not to be interested. And I want to show that may also be responsible for some of these challenges, especially with the burden we are facing in Nigeria and at the global level.
Okay, thank you so much, Doctor. We'll take a short break now. Stay with us. We'll be back in a moment.
Thank you.
Welcome back. It's Health Matters on Channels Television, and we're discussing how to tackle hepatitis. We are talking with Dr. Ganiyu Jamiu, a consultant public health physician. You're welcome back. And why is hepatitis considered so dangerous? I mean, they often compare it to AIDS, and some people even say it's worse.
Yes, why it is considered so dangerous is because in terms of if level of infectiousness is higher than that of HIV, it has been attributed that is even about 4 or 5 to 6-fold more likely if somebody is exposed to both disease. An individual is more likely to get hepatitis if exposed to both because of the infectiousness of the virus. That will make it deadly. And another thing is the fact that, I said earlier, majority of those that develop acute and even chronic stage of the disease, some may not know at all because they may live in normal life, whereas the virus is causing serious havoc to the liver. So that will make it a bit more serious in terms of public health than that of HIV/AIDS. And again, another thing I want to say is that diagnosis and treatment of hepatitis appear more complicated. We have our guidelines as well. It's not as straightforward as that of HIV, and it requires some specialist care at a certain level. But in the country, we are trying as much as possible to see how we can simplify testing and even diagnosis. Unfortunately, in HIV/AIDS, we have free treatment for antiretroviral drugs, but in the country, we don't have that. Everything is out of pocket. Even at screening level, individuals need to pay. They talk less of when it comes to treatment. And for instance, let me give you an example. For HCV, that's hepatitis C, that's cure. For somebody to be able to be treated for a period of 3 months, that person may be required about over 300,000.
Wow.
So that's an issue, and so that's another thing that make it an issue. There's no free treatment, and people are so ignorant of it. That's another issue. Awareness is very, very low in Nigeria. People don't know about.
But can you say with all certainty that if somebody has a hepatitis infection and comes to the hospital, that they'll be able to detect it, that they will be able to diagnose it accurately?
Yes, especially both. You can diagnose it, just that in terms of screening, it's very simple. Simple rapid test kits can be used to make a kind of diagnosis of hepatitis B. And that of C, the antibody, you can just use it to have an idea that it's likely somebody is exposed. But there are other more advanced tests that need to be carried out. For instance, we have to do viral profile, viral load. We have to use, like for hepatitis, we have to use PCR, and that is to be able to detect the hepatitis B DNA. And for that of C, we will require PCR to be able to identify, to show whether there is presence of ACV RNA. So it requires viral load testing, and these tests are very expensive. Viral load testing, it ranges from about 35,000 to even 80 something thousand in some health facility. So look at that. How many people can afford that as an individual? So these are some of the challenge with viral hepatitis. The only way forward in Nigeria for us to be able to actually respond appropriately and make significant progress when it comes to intervening on issue of hepatitis. It is when the policymaker government take it as a responsibility to make it free for people one way or the other, just like we have that of HIV at the moment, where there will be free treatment for that, and there will be emphasis on the issue of everybody should be vaccinated in one way or the other. Not that we agree, yes, children are more prone. Majority of the new infection is through children, but there are some adults population who are not vaccinated and they cannot afford the 3 doses. So we need a policy change so that everybody can have access to hepatitis B, especially immunization. Then in terms of treatment, hepatitis B does not have cure for now. Only a few percentage, 1%, have been able to achieve some level of cure. It's a long time thing, just like HIV. It's only hepatitis C. Unfortunately, the prevalence of hepatitis C in Nigeria of B is higher than that of C in Nigeria. That of C is just 1.1%, and epidemiologically, it has been reviewed in states where they are. So very easily we can achieve what we call micro elimination for C. But for B, as I've said, government can still do something. But that's why it's been long life approach. With support of government, I think we can achieve the elimination goal by WHO by the year 2030. Thank you.
How does one person transmit this virus to another?
Yes, usually just like the way somebody can be infected with HIV through blood, sharing of needles, sharing of sharp objects, transfusion on screen blood, through mother to child, just like HIV. And even at times during kissing, especially when somebody has injuries in the mouth, maybe there is already some sores in the mouth, so on, and somebody uses a contaminated brush, somebody can still get, transmitted with hepatitis. So these are, and all these tattoo, scarification marks, and so on. All those traditional harmful practices, like all the using on female genital mutilation, so just like normal way HIV, it can be unprotected sexual intercourse and so on. So that's the same way somebody can get hepatitis B. Get hepatitis B, including those that inject drugs. I forgot to say that. Those that inject drugs are at higher risk of getting infected. Those are, we call them the key population. That is men who sleep with men, those who sell sex. So those people, it has been found that the risk is higher among those category of people, and the prevalence has also shown that it is higher among those category of people. So that is why at the moment there are interventions for that. So that are different ways someone can get. For hepatitis C, really, they tend to be more among those that inject drugs, and when somebody is transfused with an on-screen blood. So very easy for someone to get hepatitis C. But it has not been established whether hepatitis C can be transmitted through mother to child. Thank you.
For such a widespread infection all over Nigeria, all over the world, do you see it feasible to bring it down to primary healthcare level, for more widespread treatment, management, and acceptability in the public?
Okay, thank you very much. I think at the national level, I'm the national focal person for viral hepatitis in the country, and I want to tell you that there have been a lot of effort to say that we simplify testing in line with the WHO directive recommendation, and we are trying round the clock to see that we achieve that. And one of the key steps we've done or will be carried out so far is the fact that we'll be able to review our guidelines to be able to address issue at different level of care. What is required, it is expected in that guideline, at least at PSC level, somebody should be able to screen for it. Apart from screening, to be able to refer, to be able to know the right thing to do, to be able to provide home-based care, to be able to vaccinate eligible people. It's not everybody that is eligible for vaccination. It's only those people, especially for B, those people that are negative, tested negative for hepatitis B. Those are the people that are eligible for vaccination. So at secondary level too, we have some basic care that is being captured in the guideline, and that also involves issue of treatment and so on. But I want to tell you, for C, we are looking at a situation whereby an individual can be treated at the primary care level, because it just after the normal profiling to know the viral load, to be able to know where there are different criteria we use to arrive at diagnosis to know whether it's a cirrhotic liver or not a cirrhotic liver. If after establishing that, what they need to do, there are criteria for that, and I think that can be offered at the primary healthcare level, and that's our thinking and our direction at the moment, so that somebody can be given antiviral. We call them directly active antiviral. That is for hepatitis C, and we are working around that and ensuring that there is linkages, a kind of feedback referral system, so that if there are any complications, they can refer them to any of the gastroenterologists who is trained at secondary and tertiary level. So we are doing that. And at the moment, what we were able to do is that recently we trained some staff of custodial centers, that is our prisons. The approach we used was that we'll be able to develop a guideline that integrated HIV and viral hepatitis. And I want to tell you that we started training. We trained some couple of people from custodial centers, and we'll be able to train those people that man what we call OSS, all those that provide community-based intervention.
Dr. Ganiyu, I'm afraid we'll have to leave it at that, but that's a perfect way to end it. That progress is being made. Thank you so much for coming on the show. We appreciate it.
Thank you very much. Thank you. Bye.
And thank you so much for being there with us at home and wherever you are, watching us on whatever device. Have a lovely day. I am Mary Alale Yusuf.